Welcome to Comcast Local Edition. I'm Donna Richardson, and my guest this hour is Charles Gould, National President and CEO of Volunteers of America. Charles, thank you for joining me.
Thank you for the invitation.
Always a pleasure to see you. Now, for those that may have heard of Volunteers of America, but they're not quite sure all that you provide for us, give us a little bit of background.
Great, I'd like to. Volunteers of America is 113 years old. It's a nonprofit organization that works in over 400 communities across the country, helping about 2 million people a year in need. Now, those needs vary. There are individuals who are homeless and homeless families who we work with. There are people with disabilities, at-risk children and youth, and seniors. And we've done this work now, again, for over a century. But we're really ramping up now the work that we do with seniors. We've launched a new initiative that we call Aging with Options. And the goal is to make sure that seniors, as they become more frail, can continue to live at home regardless of their means.
And I think statistics find that if you're able to stay in your home environment, you thrive a lot better. You seem to maintain your quality of life and happiness versus having to move.
That's
now,
right.
Give us an overview of the kinds of home and community-based services that you're able to provide with this aging initiative.
Well, there's three different models to it, and at one end are people who really need just interventions periodically, and it's very light touch, if you will. That would include volunteer banks, where they may volunteer some time to help one another, and then when they need help, they can draw down on those hours. A second category would be people who need more regular help with homemaker services or maybe some home health care. And then finally, people who really need ongoing assistance. And in that case, they can enroll in a program we have that really makes sure they're getting medical care on a regular basis. But an example of the first type would be a woman named Mary who lives in her own home. And she comes into one of our day centers a couple times a week where she gets a meal, she has lunch, she socializes, and she had a situation develop at her home where she was really taken advantage of. A couple of salesmen convinced her that she needed a security system at quite a high price, and they started drilling holes in the wall, and she didn't know what to do. But because she had this trusted relationship with Volunteers of America staff at the center, she was able to call them, and we were able to send out a senior advocate who reassured her and then worked with the police to make sure that she got her money back and they stopped the installation. And that's an example of really the lighter touch is just a little bit of intervention that someone needs so that they feel comfortable that they can live independently.
And that is important. And like you said, the fact that she had an opportunity to deal with people on an ongoing basis, that she had ability of trust.
Yes.
Now, is that also tying into why it's more preferable for people to be able to stay home and community-based?
It is. People want to live at home. I mean, we all want to live at home as we age, and that's part of it. But there's also a really a strong financial reason to be doing this and doing this now. We are looking at an explosion in the number of seniors in this country. The people over age 65 are going to double between now and the next 20 years. So we're really at the beginning of that period, and we have to find a way to provide more cost-effective support that let people stay in the community in less costly settings so they don't have to enter a nursing home prematurely.
Well, we have about 40 seconds left, and there's a call to action as part of the Comprehensive Health Reform, Healthcare Act. And how does that impact with the seniors?
Well, we really believe that we need better access to home and community-based services. Right now, there's a bias in our healthcare system for nursing home care. And people on Medicaid, for example, can get nursing home care. That's an entitlement, but they can't necessarily get access to home and community-based services. Well, that would be more cost-effective if they could get it, and it's preferential for them anyway. So we believe that long-term care reform has to be part of healthcare reform. And the key is to make sure that people can get access to these home and community-based services.
Excellent. Well, Charles, thank you so much for joining me.
Donna, thank you. It's been a pleasure.
My guest this hour has been Charles Gould, National President and CEO, Volunteers of America. And if you're interested in what Comcast is doing in your community, go to On Demand and click Get Local. For Comcast Local Edition, I'm Donna Richardson.